Hey guys, thanks for joining me this week on For All Things Lexington. It's the only show dedicated to Lexington, South Carolina. Here, you'll hear me talk to people, groups, bands, and organizations about where to go, what to do, and who's who in and all around our beautiful Lake Murray. I'm your host, Angela Barrett, and this is For All Things Lexington.
The For All Things Lexington podcast has been brought to you in part by
Hey, Dr. Connor, thank you so much for being with me today. I've been looking forward to this. And Elizabeth, right?
Yes.
Yeah,
Thank you for having us.
being here too. Collaborative healthcare right here in Lexington. Actually, on Old Cherokee. I had to make sure. Tell me about collaborative healthcare because it is not your typical chiropractic care.
No, we've been here 22 years as of November. I started in 2002 as a solo practitioner chiropractic office, and we had massage therapy. And then over the course of about 9 or 10 years, we started to look at maybe offering some different services in the office. So about 14 years ago, I changed the name to Collaborative Healthcare because we brought in medical, we brought in also massage therapy, now PT, and with chiropractic care. And I just felt like the word collaborative kind of brought it all to fruition for what my brainchild was to bring all professions in one house to make it more efficient for our patients.
Right. And you mentioned something about PT. I know you do a lot for the high schools as well, right?
Yeah. Yes, ma'am.
Yeah.
Yes. I work with River Bluff in Lexington, a lot of cheerleaders. I work with, I would say, more
They
cheerleaders
think
than
that's an
anything.
easy job, but it's
But
not.
those girls beat themselves up. When we were in high school, girls kind of just raised their hands and their legs, and that was it. Now these girls have to be gymnasts.
That's right.
So we work on a lot
And then
of
there
those.
were the flyers who were
Oh, yeah.
always in the air. Yeah.
Yeah, you got that. And then just baseball players, golfers, football players, wrestlers. I mean, we work with all of them.
Yeah. You see a lot of wrestlers?
Mm-hmm. Yeah. I mean, they're kind of like what I do all day. I mean, chiropractic, we kind of wrestle people all day. Is a very hands-on physical job.
Right.
Those guys also, they're snaking around on the mat trying to get that, the best physics on someone to take them down. And it just puts a lot of stress on the body.
Yeah, it is a very physical sport for sure. So let's, where do you want to start here? Because there's a lot that y'all do. So tell me kind of where you want to go. I know it's getting ready to be 2025. So a lot of people think about that weight loss. You might want to start there, or we might end there. I don't know.
Right. Yeah. And that's one of the biggest things that we wanted to really kind of hit today were two things: the weight loss, which Elizabeth, our nurse practitioner, does, and then also our Empower RF platform, which is an FDA approved piece of equipment that really works on reducing the wrinkles and fine lines and loose skin. Also works with cellulite, which is extremely good at. And then we also have a women's health portion of that too that treats urinary incontinence and another condition, which is female rejuvenation over time, which can create, UTIs. And really the only kind of options you have right now is surgery. So with this machine, you have little to no downtime, right? I mean, it's really no downtime and really no risk of high infection and all the things you got to go through with surgery to keep yourself looking young and functioning at a high rate. And it's been extremely effective. And we've had it, 3 months now? So yeah. And I'll kind of let her, kind
Okay.
of lead you a little bit on that because she knows all the ins and outs of that and the treatment because she's the one doing the treatments.
And so tell me what the name of this is called again.
It is a machine by N mode, and it's Morpheus 8 and
Okay.
Empower.
And Empower. And Empower is what you're talking about, the women's, the sort of the women's care part of it, right?
Mm-hmm.
Yes, ma'am.
Yeah, it's called
And that's what
Empower.
helps with incontinence and
Yep.
and things of that nature as well as others.
Yep.
Right. And with the Empower RF, when I'm treating urinary incontinence or chronic UTIs, they do 6 treatments. 1 treatment weekly for 6 weeks. And then with the rejuvenation, they do 3 treatments every other week. If I've had great success, I've had several women that were they were going to do surgery for the urinary incontinence, and they are not having to do surgery now. They're extremely happy.
Oh, nice. And so you do those two kind of as a program together.
Yep.
Perfect. And so how long does that take? I know you said 6 treatments and then
Yes,
3
ma'am.
or 8. So how long, over months, or how long does that take?
It takes about 2 months, and the treatments only last maybe an hour.
Oh, that's not bad.
No, it's not bad at all.
Nice. And then your that Morpheus 8. Tell me about that.
That is for the wrinkles and your fine lines, and it helps produce new collagen, and you can do your face wrinkles, the turkey neck, and it also body fat. There I do a lot of abdominal, the legs and arms, and I've been having really good results with that too.
Cellulite.
The cellulite.
Cellulite's made even as
Yeah. Now how many treatments of that do you need?
So those are
Normally.
3 treatments, and those are every other week too. You do 3 of those.
I gotcha. Per area.
Yes.
Gotcha. Well, you probably need to sign me up. And some of the other medical treatments that I'm got your website up is it says men's hormone replacement, but I don't see women. So you only do the men's side of that?
No, actually, I do the women's too.
Oh, okay.
I've actually started doing women's hormone replacement. So,
Okay.
yeah,
Sounds
I'm doing both.
And the sleep apnea, that was the other thing that I noticed. What's that about?
So instead of going into like a clinic to have your sleep study, spending the night, I have the home sleep study, which is very effective. And the patient comes in to see me. They do their signs and symptoms. I teach them how to place the machine on them at night. They sleep with it one night, bring it back to me, and I download the data, and I have a medical doctor read the results, and he sends it back to me within 24 hours. And I go ahead, I can order their equipment and machine if they need it, or if they need a mouth guard. So it's been very helpful for patients sleeping in their own home, very comfortable, that they're having to go into fiddle setting here.
I had to go in the sun here early.
Yeah, wow.
Sleep back.
So do wives get to go in there and tell you what the symptoms are?
Starts.
Okay. All right. So the other thing I wanted to real quick so that people understand, we have, Dr. Connor, who is the chiropractor, and then you are not a MD, but you are under an MD because your license again is nurse practitioner. Okay, just won't make sure everybody knew where we were. Yeah, so I actually may be calling you about that. Maybe I'll get some sleep. Perfect, perfect. And what is the V tone?
Okay, so that if there is part of an area, it is for the
Bring Coke a little bit closer.
that is for the lower arm F2. That's for the pelvic floor strengthening for the urinary incontinence. That's one
I
of the
gotcha.
6 groups that you
I
do.
gotcha. Okay. All right. So all that kind of went together. I gotcha. I gotcha. And the whole weight loss program that you have,
Mhm.
let's talk about that.
So it is a 12-week program, and it's very personalized. And the patient comes in, and I draw labs first to see if they qualify, do a health history, go over their medications, make sure everything is good to go. And then we either start semaglutide or tirzepatide, which are the GLP-1s and GLP-2s. And they come in to see me once a week for 12 weeks. And I go up or down on their dosage. I look at what they do weigh-in. I give them food sheets, and they do records of what they eat. And I try to help them learn to eat healthy and exercise. And they do that for 12 weeks.
And so now after that 12-week program, do they stay on those medicines or?
They do. I actually have a maintenance program after the 12 weeks where they will come in for maybe once a month, or I have some people that come in twice a month and they receive an injection. And that's been working very well. It helps them keep their weight off. I have great results with that too. And they can stay on this medication actually for the rest of their life because it's been around for 20 years, and it helps decrease heart death 33%, heart failure 18%. So it's got a lot of great benefits. My background is cardiology, and before it got approved for weight loss, we treated the whole patient, the cardiologist I work with, and we were seeing the results with the weight loss with our heart patient and diabetic patient. We would kid each other that one day it was going to be approved for weight loss, and it's 8 years later, it's approved.
So it is approved for weight loss.
Yeah.
Gotcha. Gotcha. You hear all this stuff on the news or whatever, or Facebook, Instagram, you're like, not sure.
Been on it. I lost 26 pounds. I was the first person. She's been on it.
I lost some of your pants.
She lost 100 beans.
Wow.
One of our front desk girls as well as Happy lost 72 pounds.
Wow.
My wife, who has been unsuccessful after having children, trying to get the weight off, she just couldn't seem to do it. She's lost 34 pounds. It's amazing, and for me, it wasn't that I eat bad. I just ate at the wrong times when I wasn't working, and I ate too much. And what this does is it's just an amino acid chain. It's a peptide. And what it does is it just helps you fill up faster. Like where I used to eat a 16 or 20 ounce steak, I get through half of it and I'm done. So me and my wife usually end up splitting food when we go out somewhere. So we save money on that now. But it has been a game changer. I've kept the weight off. I'm in 34 jeans. I had been in 34 jeans since my 11th grade high school years.
Wow.
And I've kept it off for almost 2 years now.
Nice. Nice.
So it's a game changer.
Yeah, absolutely. So, let's talk now. Elizabeth, did you want to talk about any of your other programs that you have in that, what I call the medical service end of it? I can't hear you.
I also do general practice, just cardiology, lipids, I've used diabetes and medication management, and what else? Really,
That's pretty much.
that's pretty much it. Yeah, yeah.
Okay, great. Well, that's a lot. That's a lot. And so, y'all also have like your massage therapy and
Overload.
spinal decompression of you have it listed as your physical modalities on your website. So you want to talk about those?
Yeah. So, with chiropractic, as you can imagine, you see a lot of acute injuries and you see a lot of chronic injuries. Well, and so with those more chronic injuries, it tends to be a person who has been in the workforce for 15, 20 years, sat at a computer every day of their life, not necessarily, harboring the best posture for all those years. And so not only is there a spinal change that occurs, but there's also a long-term disc issue that occurs. It's compression on those discs from being in that posture for so long. But then also the remolding and remodeling of muscles, ligaments, and tendons. So for a very long time, you could not legally hire a physical therapist. You had to refer to them. It was basically within their bylaws. But the bylaws got changed a couple of years back. So now we can actually hire one. So for me, it was a no-brainer because now I can bring my patients through chiropractic care where we're getting an immobile joint mobile again so it can heal. And then we're able now to work on the muscle, the ligament, tendon issue, posture, and everything with our physical therapist now. So it just kind of, for me, it just really wrapped everything up so the patients really get the best care possible as opposed to doing it in pieces where they would go to their medical doc and say, well, you need to try some PT. And then they go try PT and, they maybe get okay results or go to chiropractic and we get some results. But now we can put them both together as far as I can see in my own practice. I just think our results are so much better and patients love the fact that they can come to one place and get it all done. As far as decompression, spinal decompression is primarily used for disc injury, chronic arthritis. And so really your options are injections in which we can refer to if the patient is acute enough. Elizabeth's got good connections there for us to get that done. We can get MRIs done within 24 hours with some of the folks that we use here in West Columbia. But this is something that we can use as opposed to surgery. And I'm not knocking surgery or top, there's certain people that have to have it, right? But for the most part, I think most people will respond so well to decompression to prevent the surgical aspect of things, where we can actually correct that disc injury. So I get people in here with numbness in their arm, pins and needles, weakness, same thing in the legs. And the decompression machine is able to treat cervical injuries and low back injuries. And usually somewhere between 10 to 16 treatments or sometimes even less, we can fix a disc herniation. We can get it to heal so a patient can once again get comfortable because I don't know if you've ever had a disc injury. I have. It's not necessarily the worst pain in the world, but it is something that keeps you up at night. You start to lose sleep. It's hard to work. It's hard to function in your family life. And it really wears you down. And just to be able to use something that's really comfortable, really easy to use, takes 15 minutes and 3 to 4 weeks, treating at about 15 minutes. You can really take a pretty severe disc injury and you can heal it.
Nice. And that is the actual physical machine that you get in?
Yes. Yep. It's kind of almost like sitting in your recliner chair at home, with strapping that goes around your waist for the low back, which actually pulls the hips away and it pulls the disc lightly apart, creating negative pressure, which creates suction to pull cerebrospinal fluid in that disc, which carries the immune system to the disc to heal it.
Nice. But it's not painful.
No, it feels incredibly good. Most people, stare at their phones. I mean, that's we live in that social world now. Everybody lets their phone or just takes a nap, closes their eyes, and relaxes.
Nice. So let's talk about your style of chiropractic care and all the different things that it can help.
Mm-hmm. So we see mainly neck pain, mid-back pain, scoliosis. We see disc injuries. We see chronic arthritis. We see acute sprain strains, where you're out in the yard and you've dug 40 holes and then all of a sudden you wake up and you can't move, or But we also see some kids early in life. I have worked with several children over my 22 years who have had ear infections, chronic ear infections, and just can't seem to get them better. And there is a really gentle adjustment that we could do in the upper cervicals. The nervous system there controls the level of the eustachian tube. And when a child is very young and their mandible and face is not fully developed, the eustachian tube sits pretty flat. So any fluid that gets in there can't drain. And that's where the ear infections come from. If the need for the adjustment is found in the upper neck, it's usually C1, C2, we use an adjusting instrument. It's a real light, just a little tap to move that first cervical. It changes the neurology of the muscle that holds that eustachian tube flat and relaxes it a little bit so the ear can drain. So we've really prevented a lot of moms from having to go through the tubes, because I don't know if you've had children and had to go through that. A lot of times your body pushes them right back out and, they are back to square one again. So this is just a really easy way to help with that problem without having to go through the surgery, possibly damaging the eardrum. So,
Yeah, I'll say this: when my son, again, I think we talked about this earlier, baseball, lot of baseball. We played travel, but he was even before that, really young, and probably just because he was out of line, kept a lot of headaches.
yeah, we work with a lot of
And
headaches.
And we went and, once a week for I don't know how long for headaches. And he was completely fine. I mean, after even the first one, just
Sure.
from being adjusted. I mean, we're talking 10,
Mhm.
probably 12
Yeah.
for sure, in
Right.
that time frame, weekly and then every other week and then I think monthly. But I mean, no headaches unless sick, obviously. But
Mhm.
that
Yeah, we
helped.
do treat a lot of tension headaches, migraines as well. Um, a large percentage of headaches are due to tension that builds in the upper back and neck over a very long period of time. And if it's not fixed, it just ends up in the symptomology of head pain. With migraines could be nausea, light sensitivity, and we work with TMJ as well. I've got a patient in here now that I'm working with TMJ. And it's all about form and function. If you can get the body functioning better, the body is an amazing miracle machine and it wants to work well. Sometimes though, it needs a little nudge in the right way to get it to work more efficiently. So you don't have these symptoms because headaches are not normal. I can't
Right.
remember last time I've had a headache, and I get adjusted once a week, and I have so since I was close to 14. I guess I've been under chiropractic care, but it's a great way. Excuse me, it's a great way to keep your body working at its maximum efficiency.
Yeah, and the only other story that I think I went for headaches, and I do get migraines, not as often as I used to, but adjustments do help. But I just like to be adjusted, but that's terrible. But I had a friend of mine who couldn't get pregnant, and I'm not a big medicine taker, so I'm a firm believer of chiropractic care. And I said, "Girl, go get your body straight. Something's wrong. You're young. You should." I kid you not, in 3 months, that child was pregnant. And the only thing she'd changed was chiropractic
There you go.
adjustments once a week. So,
Well, just think about the nerves. There's 31 pairs of nerves that course through that spine, and that spine is basically designed with bone to protect that stuff. And if there is changes in that joint, there are changes to how that nerve communicates to the rest of the body to tell the organs what to do. I mean, it's not just to give you pain. It's making every cell in your body work. So if there is something that is not functioning well in the area of the spine that controls reproductive organs, and you
or
just
anything else for
remove
that
that
matter.
pressure, who knows what will happen?
That's right.
You
Yeah,
just
yeah.
kind of sit
So
back and watch.
that's my testament for chiropractic care for sure. It wasn't even mine, but yeah. And like you said, migraines or things like that can, I mean, it's all kinds of things that it can help with other than bones.
Right. Absolutely.
Um, Now, do you see a lot of runners?
I do. I tell you that today I actually, when I first started practice, I saw a lot. I don't see as many runners. I don't know if people have maybe switched gears a little bit and they're walking fast to take some of that pressure and stress off their knees and backs. I do have some marathon runners. I do have some of the guys that run the Spartan races and Iron
That's
Man,
crazy.
which I tell
Yeah.
you, those people are that is just an amazing thing to do. Actually had a guy in here, I believe he's 53 or 54, and he finished an Ironman this year, which to me is amazing. His training schedule was just unbelievable, but he used chiropractic as a part of his process to just try to help his body recover from all the training you have to do to finish something like that. So I do, I'm seeing some of those folks too.
Yeah. The group that I was running with for a long time, we talked about it all the time. It doesn't matter. You could have the perfect gait in your
Sure.
run, but at some point things are going to get out of whack.
Yeah.
You got to
Yeah.
go get it, or you are going to be in a pickle.
Yeah.
Um,
Yeah. It's a lot of
immediately
wear and
in a
tear.
pickle. Yeah, it is.
Yep.
It is. Now, I want to ask you about the Connor Foundation. I know that you are big in the community and you do a lot of things, but this is your foundation, right?
Right. Yeah. It was started for Chris Connor. I'm an only child, and Chris was my first cousin, but Chris was my brother. So
Right.
it's still hard to talk.
I'm sorry.
That's okay. We were very close. But we started a band. I moved here in 1993 from East Carolina and up in North Carolina. And we'd always sang and just played instruments. My dad's a guitar player. We have a lot of musicians in our family. Brian Connor is also, with Villanova, he was also pretty big. We started this band called Sourwood Honey, and we played for many years and very close to making it, but just didn't quite make it. And Chris continued to play music, but at 30, I think he was 35 when he got diagnosed. He was diagnosed with stage 4 lung cancer, which is just at that time was just such a weird diagnosis. All of his oncologists said that that's like a 55-year-old or 60-year-old smoker since they were 12. And Chris did smoke, never was a heavy smoker, and he had actually quit for about 5 or 6 years before this diagnosis. But I mean, we were around it, I guess, a bit in bars, and he passed. And so, as you can imagine, a musician, you can't afford health insurance, and the bills were unbelievable. And so family members got together. Actually, Brian's wife, Ashley, was very instrumental. And let's do a big golf tournament and let's try to raise some money. So the first golf tournament was the Christopher Connor Foundation golf tournament at Lexington Country Club. And the community just was amazing. Just the amount of money that we raised, it was incredible. So he passed, and we decided as a family that we wanted to keep it going. And so I guess it's been 18 years now that we kept it going, and we try to help musicians, especially because they don't have insurance, they can't afford it, and they're out entertaining us all the time with their talents, and so we just want to try to help them, and we have helped a ton of people. I mean, we have donated so much money. We work with Epworth Children's Home. We worked with the Children's Hospital. We set up a music therapy room there for the kids receiving cancer treatment so they can have some type of smile on their face at least once in a while. We've given back to so many musicians to help them with treatment because we've had a lot of musicians who've also, been dealing with cancer. Just gosh, the list goes on and on. I don't know how I'd have to go back and look at everything we've done, but it's been amazing. And it was, in Chris's name. So
Yeah, what a great foundation. And I was trying to put together, I was like, why do every time I see his name, there's like sometimes not every time, but a guitar around. What is this? And so I finally dug deep enough to figure it
That's
out.
it. Yeah. Yeah.
But what a great foundation. Yeah. And so it's really to help musicians, medical assistance is the main purpose.
Yep.
Yeah.
Yep. Yeah.
And y'all
We've
still
got
have the golf.
scholarships out there as well at the high schools for kids who want to go into music in college. And so, there's scholarships available out there, and there are so many scholarships out there that no one even applies for. And
Right.
but it's in all the schools in Lexington District 1, I am sure. And so, if anybody hears this and they got a kid that's wanting to go into music in college, there's a scholarship out there for you if you would like to apply. Just ask, your high school counselor, and they can direct you towards that.
Perfect. And y'all still have the golf tournament?
Actually, we just did our last golf tournament last year.
Those are kind of big to tackle.
It is. It's a lot. And honestly, most of the people on this board are friends of Chris's family. And it is a lot to do, to put on. And everyone has just gotten a lot older. And so we're thinking about transitioning into maybe having like a music day where we have 5 or 6 or 7 bands play and raising money that way, and letting some friends of ours manage that for us. And it would be a little easier on us. So that's what we're looking at for next spring.
Oh, cool. Cool. Well, I'll look forward to that. Can't play golf, so can't do anything there.
Right. You can listen to music.
Yeah, I can listen to music. I'm pretty good at that. Well, I thank you so very, very much. And anybody listening, if you're looking to lose weight or have any kind of back injuries or wrinkles as well.
That's women's health. Yeah.
Yeah, I was going to say collaborative healthcare is where you need to go. Well, thank you so much, guys, for being with me today. And it was such a pleasure talking with you.
Thank you very much. I appreciate it.
Absolutely. Hey guys, thanks for hanging out with me today, and I hope you enjoyed the show. If you'd like to be a guest on the show or know someone you'd like to see on the show, contact me at forallthingslexington.com. That's the number 4, allthingslexington.com.
And by Angela Barrett at HomeMattersSC.com. Building on what matters to you.